just found it very happy. So the talk today is going to be focused on several subjects and topics. The one that I'm very interested to talk about is the epigenetic treatments of cancer, because that's probably the most of what I do on a daily practice. Patients who come to see me, they are either local, they find me through word of mouth, their friends and families who've been treated, or they get referrals from other physicians who they refer them to me and they know me, or they basically have research through the internet and they're looking for an alternative or integrative cancer therapy. So the idea here is that you basically have to understand why they are doing that. Why is a patient looking for an alternative? The reason is obvious to the cancer patients because they receive conventional treatments for cancer, and most of them, especially in advanced cases, they don't see any improvement. Most of them lose their quality of life without any gains. And the ones that have just been diagnosed with cancer, they have seen their family and friends who've been tortured and suffered through aggressive uses of the chemotherapy, and they don't want to go through that route. Now that said, I'm not against conventional treatment, and most of my trainings were in conventional treatments of medicine. The reason that we need to be educated about non-conventional treatments in cancer is because cancer therapies unfortunately have many side effects, and if they're used blindly without looking at the type and the genetics of cancer, they can cause problems and even make the cancer more aggressive. So the idea here, as you're here to listen to my talk, is that you get educated about the treatments that are more targeted, more focused on the genetic of the cancer without causing those severe side effects, and the treatments basically improve the quality of life of the patient instead of taking that away. So that's the goal. Now, the basics and the core concepts of the molecular-based oncology in a glance, we're going to talk about technicalities in the cancer, how the cancer develops from beginning, what molecules and targets are signaling the pathways of growth of the cancer. We're going to talk about that so that the oncologists also in the audience will be more familiar with what we're doing. We're going to clarify some misconceptions about integrative oncology. Just like I said, we're not against conventional treatments. We think that conventional treatments have to be, and that's the must, combined with non-conventional treatments of cancer to be effective and with less side effects. It's not basically an option. It has to be combined. And if somebody doesn't combine the conventional treatments with non-conventional effective treatments of cancer, they are going to most likely lose the battle. We are saying that this is not an alternative medicine. We're saying that this is more standard than the standard of care. We're saying that this is more conventional than the conventional ways of treating cancer. So it has to be, it must be combined with the conventional treatments. We're going to comprehend the genetics in the cancer. We're going to talk about the epigenetics, as that's the subject of the talk. And we're going to explain how important is the epigenetics in cancer, because different people have different genetics, and therefore their cancers have different genetics. And there are many epigenetics, which are father genes that are controlling the genetics of the cancer. And when I give the talks, I always explain how the epigenetics work. Epigenetics are the genes that are superior. They are higher in the level of control to the genetics. So if you have a bad gene and you really can't get rid of it, and that's in your DNA and chromosome, the epigenes are not there. The epigenes are in a higher level. They control the genetics presentation or the gene's behavior. It's like you have a bad child and you have a good father. So the father tries to control the bad child's behavior. And if you have a good father, you can do that. But if you don't have a good father, that's when you don't do the non-conventional treatments, then you can't do that. So the idea is that if you have a bad gene, which most of the cancer patients do, you have to be able to control that genetic expression by modifying the epigenetics or controlling or educating the fathers of how to control the gene's behavior. We're going to talk about the immune system and correlation to the cancer. Immune system is extremely important because 90% of my cancer patients, they are immune suppressed. And unfortunately, the standard oncology environment is not even providing trainings to the oncologist in the sense of how the immune system plays a role. So the standard oncology does not even know how the immune system is affecting the body's response to the cancer. And what part of what we do is that we provide immune enhancers to the system that specifically are designed to go after cancer cells. And especially when a patient is under the care of an oncologist by using chemotherapy, those chemotherapies very well may, and some of them will suppress the immune system. And so it's extremely important to combine these treatments so that this doesn't happen as much. And then we're going to talk about confronting cancer as a chronic condition. So just like any other chronic disease, when you wake up in the morning, you don't have diabetes, you're not waking up in the morning and you don't have hypertension, you don't wake up in the morning and you have cancer. You may wake up in the morning and you go to your doctor and your doctor says you have cancer, but that's the day that he diagnoses you. But for many, many years before that, you actually have been struggling with the cancer. As you know, many studies show that patients 10 years before they're diagnosed with cancer, they have cancer cells floating around. They have even micrometastases before a scan shows that you have metastases. So that tells you that there is, again, another failure of the conventional diagnosis of cancer and a conventional oncology work, because they cannot diagnose or even prevent a cancer before it happens. They use standard screening testing such as thermography and colonoscopy and all those things. But those screening tests are very, very late. You really need to have a full genetic profile of a person to know if she or he is at risk for cancer before it happens. That's why when a patient comes to see me, I ask them, what's your family history? And if they tell me that I have a cousin or a mother or father who was diagnosed with cancer, I do those genetic testings. And I tell them what's their genetic risk of getting cancer. So preventive oncology is part of what we do as well. So that's something that unfortunately is pretty much missed in the conventional world of cancer. So when cancer becomes chronic disease, you need to treat it. Do you treat hypertension by transplanting another heart? You don't do that. You treat hypertension chronically with changing the environment so that if you have less inflammation, if your insulin is controlled, your blood pressure drops. And this is a lifestyle modification program you have to go through. It's not that, okay, I just take this pill, but then I do whatever diet I like and my blood pressure will be controlled. So you have to do chronic management of the disease. The same thing is true and pertains for cancer. You have to do a chronic management. Your diet has to be changed. Your lifestyle has to be changed. You have to exercise. All those things happen because the cancer is a chronic disease. And then we're going to